To a lifestyle show from people you know with Emily Irwin. Now, Central Valley Today.
Welcome back. Joining us again today is dermatologist Dr. Marvin Rapaport with more information on treatments for eczema and the risks of topical steroid withdrawal, also known as red skin syndrome. Dr. Rapaport has helped thousands of patients to stop using steroid creams and overcome their addiction. He counsels people from around the world through the withdrawal process, helping them to regain their quality of life. Dr. Rapaport is sharing what everyone should know about topical steroid withdrawal, how it can be successfully treated, and why some doctors still don't recognize the condition as real. So, doctor, thanks for being here today. What are you hearing from people you're helping go through withdrawal from topical steroids?
Well, they're so pleased when they find scientific knowledge and simplistic therapies that have a cure at the end. And I can tell them that we've cured 10,000 people. 10,000 people over 40 years. Takes a long time.
I have seen some of these before and afters, and the before pictures are fairly shocking, but the after pictures are just as shocking because they're so different. But many people go undiagnosed for topical steroid addiction, and you've said that some doctors don't even believe that it's a real condition. Why is that?
Well, it depends when they were trained, and in the last 30, 40 years, they are being instructed that these patients have bad eczema, B-A-D, eczema, and they're going to have it the rest of their life. And there's been a little bit of chicanery going on. The drug companies who have come up with 9 new drugs, very expensive new drugs, are also telling the doctors that you might have to treat these patients for the rest of their life with our new drug. And that's the only way because it's bad eczema. Well, it's not true. Eczema burns out. In the textbooks of 1930s and 40s and 50s, it burned out. Asthma burns out in the early years of life. And the steroids have been perpetuating a different kind of rash.
Well, it's just I think it's such a refreshing philosophy to hear from a physician that we do not want you to be dependent on medicine for the rest of your life. And you say that eczema is not a chronic condition and that most reoccurring cases are actually the result of using steroid creams for too long. What guidelines do you recommend for using steroid creams, and what should people do if they're experiencing reoccurring or worsening symptoms?
Okay, but I must intercede. One fact. 90% of the patients are atopic dermatitis eczema patients. 10% are different diagnoses who exhibit the same complaints as these supposed bad eczema people. That's seborrhea, that's psoriasis, it's chronic itch of older age, it's Grover's disease, it's photodermatitis, contact dermatitis. They look exactly the same as these 90%. So how can there be, two different things going on and they all look alike? I tell them that they've been barking up the wrong tree, and they know that by now. By the time they get in touch with me, they have researched everything. They're so miserable.
Yes.
Luckily, they're not sick. They're just miserable.
And desperate for a cure. So you say yes. That topical steroid addiction can be cured. How do you define a cure?
We talked with John last time. You saw him. He's perfectly fine. White skin, no rash, no scratching. He was taking 9 showers a day for 24 years. He does nothing like that anymore.
And John, your patient that we referenced there, he says that he's always surprised year after year, his skin gets even better than he thought it could ever be. So John is one of your patients. We have that clip online if you want to watch it, but you're using telemedicine to help patients around the world who are suffering from topical steroid addiction. How do you guide patients through the withdrawal process, and how long does it take to achieve a cure?
Well, for sure, hand-holding is huge. Lots of psychotherapy. I start every patient, no matter where they are around the world, with a phone call or a Zoom meeting. The phone call lasts about an hour. I go through everything. I answer all their questions. They understand. If they don't, I try to tell them the skinny, and they're ready to suffer a little bit with this, with the symptoms. And I say, I have medicines for you, or we're going to work with your doctor in Australia, in Spokane, in Virginia, to help us write the prescriptions, or I might write them. And we're going to be contacting repeatedly each other over the next several months until you're on a steady course. And then I start pushing you away because you get better and better.
Yeah.
You start living a normal life.
Yes. And the psychotherapy, I'm sure, is so
all
big.
of their life, they're hiding.
Yeah. Well, this is such great information. The before and after pictures are just so incredible. So if viewers are out there, they feel like they are addicted to steroids, they want to go through the withdrawal process, how can they learn more and how can they contact you?
Contact me. I'll get you in touch with my assistant, or we talk to your local doctor, or we come up with some solution where we can ease your pain and discomfort. I will not allow you to suffer.
All right. Well, you can go to redskinssyndrome.com for more information. Dr. Rapaport, as always, thank you so much.
You are a superior interviewer, plus very charming. That's very kind of you.
Well, kids get sick, but when is it time to see a pediatrician? Saying Pediatrics joins us next with some important information about kids and fever after this.